Hello, my name is Riddhi Case and my student number is 14371330, and the case study I choose for this assessment is case study 2 of Gerald Johnson. To start with, I will provide a clear description of the strength-based approach and its significance in caring for older people and strong example from case study. As per Kelly's, Silarora, Milne and Beetle Brown, a strength-based approach focuses on what people can do rather than their limitation or weaknesses. It builds on a person's abilities and resources, encouraging them to take control of their own life. This approach is linked to the CARE Act 2014, which promotes well-being and personalized care. By involving individuals, their families, and their communities, it helps create plans that support them in living the life they choose. This method emphasizes self-determination, allowing individuals to actively participate in decisions about their care, enhancing their independence and quality of life. This definition is sourced from the British Journal of Social Work and published in 2024. A strength based approach towards the care of older people holds significant importance. It focuses on their capabilities and not their disabilities. This helps the older people feel more in control and valued, and also more involved in their own care. It focuses on their actual capabilities, experiences of life, and skills that would help older people with aging well. It also involves close collaboration with other professionals in health and family members for the provision of care that respect the choices of older people, promoting independence to live a better quality of life. For example, take Gerald Johnson. He is a retired school teacher who actively participates in activities within his community. His stresses include chronic pain from arthritis and mental health issues. But it would be an understatement to say his most apparent strength relates to teaching and art. This could be manipulated in treatment to help with his pain and keep him mentally healthy. Activities such as virtual tours of different artworks or workshops would allow him to provide for socialization, but within his physical limits. The strength based approach also incorporates his family and community. His children are at a fair distance away. However, the frequent contact he receives with them provides him with valuable emotional support. The involvement of his children in his care will enable Gerald to feel connected, independent, and happy in his own familiar surroundings. Now, in part two, we will discuss two key issues and reflect it from the Gerald's perspective. The story of Gerald Johnson is the story of scores of elderly people facing chronic illnesses. Conditions such as arthritis, diabetes, and hypertension are changing Gerald's life bit by bit into something he would rather not accept. The aching feeling in his arthritic joints has forbidden him from doing things he dearly loves to do, which upsets him the most. His world shrinks, not by his choice, but because his body can no longer keep pace. To think that he will lose some of the independence that he has enjoyed all his life upsets him tremendously. He also runs a very realistic risk of becoming isolated, which in turn will worsen his mental and emotional health, further making the situation hard to bear. Another significant issue is the mental and emotional load of Gerald. Having a history of depression and anxiety, the mental load he has to carry is enormous. This burden saps the motivation that he has for anything in life. Tasks as ordinary as cooking make him tired. Choosing takeout may be a little thing to those who have not been there, but to him it adds to how deeply his poor mental state would sink into decisions. Poor nutrition from living on takeouts makes his diabetes and hypertension even worse, thus creating more health complications. Added to this, the stress of continuously ordering food adds to the financial burden, and this is a cycle of stress and ill health that he finds difficult to break. Bearing in mind the case of Gerald, his problems appear to go well beyond the medical condition management into literally all his aspects of life, including identity and independence. The two key issues were identified related to chronic pain and mental health. These are primarily associated with aging well. If these are not addressed in a manner that empowers him and preserves his independence, his health and quality of life could further continue to decline, leading him receiving intensive care that he does not desire. Now, in part 3, we will look for two recommendations for each of the key issues. My first My first recommendation to address his chronic pain would be to optimize and integrate comprehensive pain management plan for Gerald. This plan will discuss Gerald's current pain medication regimen and optimize it. This will through reviewing other medication or dosages that best manage his pain while offering the least side effects. We shall integrate non-pharmacological approaches including physical therapy, acupuncture, and relaxation techniques into his daily routine. This will enable Gerald to be and we will also make sure that the Jared is fully involved in decision making process concerning his pain and how best to manage it. This will further give him chance to enforce his independence and give him a sense of independence. To this end, he shall feel empowered and have say in his care. He shall further be more cooperative regarding the proposed treatment plan. They should be done routinely by an interdisciplinary team including a pain management specialist, physiotherapist, acupuncturist, and a community nurse who will continually monitor and adjust the plan where necessary to ensure it is effective in all dimensions of Gerald's pain and mobility. My second recommendation would be implementing an individually tailored activity tracking device which would support care for Gerald. It will track his physical activity and pain among other parameters. Such data will help to individualize his pain management plan to best coincide with his daily routines and fluctuations in pain. The tracker will allow Gerald to be active in his care, promoting his goal of independence. He will be able to monitor his health and remain active because of the motivation he gets while using the device. Additionally, his healthcare team can monitor information received from the device and make necessary interventions. To ensure this all work for Gerald, a physiotherapist, a community nurse, can help him set up the tracker and tailor it to his needs. This will then become a basis for healthcare team to modify his pain management and exercise plan to make them even more personalized and effective. To maintain Gerald's current level of functioning in regards to identified mental strain, I would recommend further psychological intervention. This would be culturally sensitive support, offering regular access to a counselor who can work with Gerald indigenous heritage respectfully. This could include stress management through various modalities such as cognitive behavioral therapy or mindfulness. One of the main strengths in Gerald is his cultural identity, and culturally relevant mental health care will increase his treatment engagement and improve his mental health. Given this, support would be necessary to involve a mental health professional who specializes in indigenous health and ensuring all cultural appropriateness. This would be further cemented with the presence of a community and elder or an indigenous health worker who could ensure such network is appropriate to the needs and values that said Gerald. This will be grounded in the philosophy of being able to provide holistic care that meets his mental and emotional needs. I highly recommend providing technology for virtual social interactions to help him become and remain connected with the family and the community. This can be done by providing him with the required gadgets and training him on conducting video calls with the family, attending online events within the community, or even taking virtual art classes. So this is my another recommendation for the mental health issues he's facing. In this way, the gap provided by physical distance and limitations in mobility will be bridged, and he will remain socially connected at a time when he is not able to personally attend various events. One of the strengths in Gerald is his desire to stay connected to his family and community. With necessary tools and skills to engage virtually, we can help reduce some isolation for him. This will also keep him mentally active and socially engaged, which is critical to him. This professional can enlist the help of a social worker or an occupational therapist in setting up the technology and training Gerald in its use. They can monitor his usage and satisfaction, making any necessary adjustment to keep him connected and involved with his community and loved ones. Thank you.